30. Can you guys hear me okay? All right. So I'll call the meeting to order. And we're in the, for those of you who don't know, we're in the health department, and Jessica and I were going to be pointing to each other when we're switching on and off our mics so that we don't get a lot of feedback. Amy, do we have any public participation?
No. Do you want me to call the roll?
No, hang on. We want to do one more thing before we do that. I want to take just a moment of silence to acknowledge the 208 deaths in McLean County. That's higher than what we had last time we met. And also the impact of that COVID has had over the last year on each of our lives, and the passing of Rich Buchanan. So if we could just have a moment. Thank you so much, everyone. Okay, Amy, we want to call the roll.
Alan Ginsberg. Andrew Held. Carla Pohl.
Present.
Corey Tello.
Present.
Hannah Eisner. Judy Buchanan. Richard Janetti.
Present.
Robert Colhase.
Present.
Scott Hume.
Here.
Sonia Reese. Susan Schaefer.
Here.
And
Don't-
Sonia just popped in, it looks like.
Okay.
Hang on, we're doing an adjustment here. Is that better? Okay. All right, so, oh, good evening, Mr. Spanos. Goodbye.
Hello.
How's everyone? I hope everybody's doing okay. The first item on our agenda is approval of the minutes from our regular session on February 10th.
Overbrow.
All right. Hang on just a second. Wait. I've got the wrong agenda. All right. We still need to approve the minute, but for March 10th. Sonia, sorry.
I'll move approval.
Do I have a second? Robert, Mr. Colhase is a second. Amy?
Okay. Carla Pohl.
Yes.
Corey Tello.
I just had a little correction, and it's under Mental Health Advisory Board, which is B. I'm not sure I have them full and sitting in front of me, but I just, it's under, there were some itemized listings, and it's under number 1, stable and safe housing, working to recognize where it exists instead of where it existing. And then under 2, where it says working to get into all schools, that should say working collaboratively with others, other entities, and with all schools. So working collaboratively with other entities and all schools. Thank you.
Do we need to make a motion, a new motion?
No, it's just a correction.
Okay.
The motion should be as corrected.
As corrected, right.
Can hear muted. We're voting in the minutes as corrected, and Amy Hannah Eisner has joined us also.
Corey Tello.
Yes.
Hannah Eisner.
Yes.
And Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Okay, our next agenda item is the consent agenda. Do I have a motion to approve? Tanya,
So moved.
second is Susan or Dr. Giannetti?
Yes.
Dr. Giannetti's a second? Okay, Amy?
Carla Pohl,
Yes?
Lori Tello,
Yes.
Anna Eisner,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Thank you, Amy. Our next item on the agenda are informational items. In your packet is the a progress report on the 2020 annual report for the Community Health Improvement Plan. It's an executive summary, and that is found on pages 3 through 6. Are there any questions? Okay. The next item for discussion, and I believe Tammy is going to lead this, is extension plan for the COVID-19 contact tracing and call center beyond May 31st due to funding, and that's on page 7 through 8 of your packet.
Hi, the plan you have before you actually is a modified version of what I had turned into originally. And actually Jessica spent more time on this than I did. So Jessica, if you want to go ahead and lead.
All right, thanks for bearing with us there for a second. So as it's mentioned in this memo, I did request an additional amount of money from IDPH to support contact tracing beyond what we anticipate to have remaining in the grant. So this is an informational item this month again, just because it's not an action item, because I have not heard yet from IDPH what, if any, additional funds we would receive. But looking at this, as the memo mentions, plan number 2 has us keeping slightly less contact tracers on, but being able to fully fund that with the remaining grant funds for the first 3 months. So that is an ideal plan. And then if we don't get additional funding, being able to come back and reassess. So again, this plan is just in here for informational items. And if there's any questions, thoughts, discussion,
Yeah, go ahead.
How is the contact tracing working? I mean, are they successful? I mean,
Yeah, go ahead.
Down?
Carla, I know that Dr. Giannetti was asking a question. I can wait a second.
Oh, okay, Doctor, I didn't hear, because I had my speakers muted, sorry. When Jessica and I are in the same room, so when Jessica's talking, I have to mute my speaker, so hence the problem. Dr. Giannetti, if you
Okay.
wanted to say something, go ahead.
Yeah, I had a question, Jessica. I mean, how is the contact tracing working? Has it been successful? And what's their percentage of tracking folks down, et cetera?
I will say that successfulness kind of ebbs and flows. We certainly have had periods of time where people don't answer the phone, or when they do answer the phone, they might tell us that they absolutely have 0 contacts, and most of us would be able to guess that that is not correct. And other times we've had perfect compliance. It just, when you're dealing with people, it just kind of depends on the current environment and what people are willing to share and willing to cooperate with.
Thank you.
Hannah, did you want?
And I think it's somewhat of a follow-up to that question. So it looked like we currently have 50 contact tracers. Maybe we have some that are contract, some are on board, but I think in your memo you said 50. And I know previously there's been an issue of being sure that we had enough. And it looks like from the later report that we've been, at least the number that was in Tammy's report said we've had 14,192. I don't know what we call those contact traces. And I mean, the report we got today was like we have about 16,000 cases. So that tells me we're really doing well and with our contact tracing. And so I guess I'm concerned if this is more of a money-driven issue and we're cutting ourselves off short to not have sufficient people to do the work. I mean, we're now currently seeing that there seems to no predicting what's going to happen week to week in terms of the number of cases, et cetera. I mean, if we were clearly into a end of days, we can see the end coming, I'd understand this sort of tapering down, but I'm a little concerned when we're not seeing that and reducing the numbers, because they do more than just that initial contact, right? Then they follow up with people who you get the names of. And so, and it's a fairly, I would assume, time-consuming process. So I guess I'm not sure where the new numbers come from to reduce to 20 or 18 and then further, except we're looking at budget crunching, or is there some other basis for that?
We're basically looking at how are we going to pay for it. I think we are concerned as well. A month ago, this plan certainly seemed like it wouldn't be too difficult of a transition to reduce staff and still keep up with the expectations of contact tracing as well as the call center. You're absolutely right, Hannah. Things have changed a little bit lately, so we have to balance out with how many staff we think we need and how many we can pay for.
Susan?
I got a couple things on the dollar stuff. Number one, the county, from everything that I've read in that American Rescue Act that was signed, I don't know, a couple weeks ago, that the county is going to receive money and it can be used for this. And also we do have reserves, and I'm with the variance and the unknowns with some of that kind of thing. I don't think we should be driven by money on this. I think that this is a public health issue and we need to do what we have to do and worry about the money as a secondary issue. I mean, I don't mean go spend freely, but I don't think we should have money be our driver, because I do think that there is funding there. Plus we do have reserves for this because we don't know how long this is going to go on. And I don't want to, like Jessica said, was it last month, where it would be harder to let people go and then get people to come back and hire more contact tracers later. I think that if we keep what we have, or, have a good plan on a good number, that's where we should be. And like I said, not have it be driven totally by money. That's my opinion.
I would join in on that opinion with Susan and say, the numbers have started kind of going up again, and this is not the time to let up on our effort.
Hang on a second, guys. Jessica wants to talk.
I've just got some, I guess, questions as we're looking at this planning. Some concerns would be that the contact tracing staff that we have on board is contractual. So keeping them at a kind of a month by month basis is it will probably be very difficult because that's a little bit of uncertainty for them. So in looking at what you guys would like me to prepare for planning, would you like me to look at, because we have no idea how long this is going to last. We don't know how long this new surge is going to last. So would you want me to look at, full staff for 3 months, full staff for 6 months?
Corey.
I thank you. I think I really appreciate how difficult this is to, base things with such uncertainty, which you've been living with now for a very long time. My question about this, before we answer that very important question you just asked us, is the money, and I agree with everyone that, we want to make sure that we are well covered because this is critical. This is about health and safety. But are these dollars, even though there may be American Rescue Act money coming, or our own residuals, reserves, I'm sorry, are there other things, Jessica, that you see related to costs that have been incurred because of the pandemic, or things that you see on the horizon that you're starting to get very worried about, that you feel like we also have to be careful? I mean, thinking about dollars allocated for other priorities. And so can you kind of just speak to, are there any other issues top of mind that we should be thinking about, when we think about allocating this money?
Yeah, so vaccination is one thing. We got, a little bit of money, which is in the packet for later for discussion. We got a little bit of money. It's not going to go a long way, especially if we're still vaccinating. It's proving to be a slow process. We haven't seen the vaccine tsunami that was anticipated. So doing a couple thousand doses a week is going to take us a long time to do. So I anticipate costs, especially personnel costs, if we don't have, if we need additional support to run clinics, that's going to be costly.
Is there any overlap? I mean, I know you've done such a good job of cross-training people. Is there any ways that are you already doing some cross-training with contact tracers and people helping do certain functions at the clinics that could help us with that, or does that even make sense?
Yeah, so the current contractual staff for contact tracing, they're contractual. So their contracts limit them then to the duties that they can perform.
Anna? Go ahead.
So what is you indicated that the cost of operating the program in a pared down manner was about 500 something thousand, I think, in your memo or Tammy's memo. What is the cost of maintaining this program at its current level? Because I agree with everybody. I mean, we've got it up and running. We've got people who know what they're doing. To stop it and then have to restart it doesn't seem like it would work very well. And I have to think, if we're in the state that there's money coming to the county, to the city, to the town, there may be additional funds coming our way for contact tracing. If, I mean, we have to plan as if it's not, but I guess I just think that, for the time being, we ought to hang tight. And as far as how you classify these employees, I mean, we have always had people who are considered what would be seasonal, occasional people who work for the summers, for example, at the parks and whatever. I know they're considered contract, which is different than bringing them on as a seasonal, occasional, but those positions have always had the understanding that when, in the case of parks or swimming or whatever, it's a limited time job. So maybe there's an avenue for them to be brought on in that manner. Now that, of course, may, end up with some fringe benefit costs. I don't know how that would all work, but certainly to keep a trained, good workforce in place at this time would be really important.
Tammy, did you want to chime in?
Yeah, I guess really, and I didn't plan this with Jessica, so I hope I'm not speaking out of turn. But I think our intention with bringing you several plans is so just to give you an idea of what we're facing. In my dream world, you as our Board of Health would say, you make a plan that you feel like you have to have, and we'll make sure that there's money.
And that's kind of what I was saying. Yeah.
Yeah, I was going to say that's what I hear the board saying is that if we need to use fund balance, I think if I'm speaking out of turn, y'all let me know. If you need use fund balance, we're in support of that. Whatever it takes, we prefer that you go, for example, with Plan 1 so that you have more contact tracers, simply because, like what everybody's mentioned, Hannah and Susan, we've got a surge going. You've got folks who are trained. I know I hear from Michelle Maurer, who works over the ISU, does contact tracing through ISU, that things are picking up and they will slow down a little bit over the summer. Maybe I shouldn't have said that out loud because I've jinxed us now, but because the students are going to be gone is why I'm hoping that happens, but not. So I think that's what we're saying. And if we need to put our heads together and put in for FTEs so that they can get benefits, that helps you retain people, because I understand that could be an issue, is retaining folks. I don't think I'm hearing anybody say, no, don't do that.
And I think Susan also mentioned the county is slated to receive some money under whatever this one is called, the Rescue Act, I guess. And I don't know, maybe you'll address it in your part, Susan, as to whether there's been any discussion about how those should be spent. I would think a lot of it should target what we need to do for public health. So there may be funds that could be used, that could be allocated for additional payment. Did anybody say how much it currently is at the full staffing that we have now?
Yeah, I don't have that in front of me, but I can bring it to you next month. Because that amount is just for 20 tracers, and we've got more than 20.
Any other? Sonia, go ahead.
I was going to say, I think the public is counting on us to do this and do this a thorough job. There's nobody else that's doing this particular work. So if we don't do it, we don't get that follow-up done. So I'm thinking this is our job and this is our time and we need to stay the course with it. Thank you.
Corey?
I would just echo that if we would not use the fund balance for something like this, I don't know what else you would use a fund balance for. This, we've always said that's for a rainy day. Okay, this is way more than a rainy day. So I think it's very appropriate to use that money.
So Tammy and Jessica, that sounds pretty, I mean, we're not voting, but I definitely hear a consensus that whatever you guys need, let us know what you need. Plan high instead of low. And if we need to use fund balance, we'll use fund balance. We'll try to get other funding first, obviously, either through the American Rescue Plan or additional money from IDPH. But if that isn't available, then we'll use fund balance for that. And then we'll work on, I guess, whatever helps us retain people that are trained, I think will probably work out the best for everyone. Because I distinctly remember what it was like in August trying to get these folks hired and trained. It wasn't so much hiring that was difficult. It was getting everybody trained so that they could answer the phones and get the right information. And especially with the way things are changing, COVID is going to be one of those viruses that, you know, likes to change itself a lot. It likes change, and I don't want to Disneyland the thing, but it's changing quite a bit. So, I mean, trying to keep people up to date on stuff is difficult. So I think that's what you're hearing from the board. Okay. Hang on, So our next agenda item is the administrator's report, which includes an update on Community Health Services Division. Any questions or concerns? Okay, Jessica, go ahead, Hannah, and give me go ahead, Hannah. Okay, Jessica, you're good.
I was, again, going back to the contact tracing, and of course, kudos to everybody for keeping other things going. We don't just do COVID. Seems like that's what it feels like. And I think I'm in the right spot on the agenda, but you know, it might be interesting. I would find it very interesting to have somebody come in and just give a day in the life of a contact tracer, give us a better idea of what happens and how many calls and whatever. Because it looks like we're doing a really great job given the case numbers and then the number of contacts we're able to follow up with. So that was all I had.
Jessica, did you wanna? Okay. Does anyone else have any concerns? Go ahead, Tammy.
If you're asking for a contact tracer or the supervisor or the coordinator to attend the next board meeting, maybe to speak for 10 minutes, I can arrange that if that's what you would like.
I mean, I'd leave it up to others as to whether or not that's appropriate. I just know I'd find it interesting. Maybe get an opportunity to put a face to this. And
I mean, I think that'd be great if you could find somebody who is volunteer and will be nice.
Okay.
Okay, so we're now down to committee reports. Behavioral Health Coordinating Council, Sonia.
Sure. That group met on the very next day after our last meeting, 2 days later. And our meeting started with the presentation by a representative from the Center for Youth and Family Services to talk about a grant that we have that's a 5-year grant to address 50 youth. The youth that they're working on, the goal is to show no more contact with the police. So that's a big order, but that's what they're working on, and they're working with Corey on this. So that's a good thing. We also talked about how the money was being spent. It was coming from the city and the town. Just as a reminder, that's a quarter of a cent of the sales of the tax monies coming in. And so a fourth of that is going for debt service on the 20-year bonds on the jail. Another fourth of it is going for the criminal justice staff. A fourth of it is going to the Behavioral Health Coordinating Council for some of the efforts that are being made there, some of the research and connections that we're making with other areas. And then another fourth is going for case management with the old system of Aegis, the way we're managing people from the courts. Susan may be able to explain more of that because she's closer to those areas. She's smiling. I'll run on through this. We looked at the org chart that was going on to see exactly who was reporting where, how that was all working, to show the connection between mental health, the emergency departments, PATH, and mobile crisis. We talked about defining how triage was working. The triage center has a connection with mobile crisis. And so they were open at that point from 7 in the morning until 3 a.m. And a number of their people were coming as a result of contacts with the Bloomington police. But people themselves can actually present there. This is not a place to stay overnight. This is not a place to sleep. It's a place to get yourself perhaps calm down, understand what is you're dealing with, and know whether you really need to have emergency department visit or just whether you're able to go home. So that's the intent that's going on there. We have an agreement with New York University to understand, and they're studying the whole disposition of patients that come through systems like this. So we're going to participate and hope that we get good information from them. The forums, we discussed the forum, and the forums are typically handled by the in-person, similar to the in-person events, except they're all online. And the good thing is that they're uploaded, so they can be seen by anybody, even after the forum is over. So they're good for universities to use in their training as well. We went over the mental health action plan. Susan talked to us about that. My notes say, she says, 5 steps forward, 2 steps backward with COVID. But that's kind of what we're having to deal with this time, and everybody's having to deal with it. So David Schrar from the Chestnut had indicated that there's 150 million available to do a study on patients that are discharged from hospitals that are identified in a whole category of problem area. And so this money is coming from hospital assessment. So I will hear more from David Schrar on that. So that's what my notes said. Susan, anything else you want to add to this or clarify or correct?
Not really. On the thing that Dave talked about, I know that there was information that was sent out, and I don't think that there was a response. After looking and listening to that presentation that they talked about, I don't think that McLean County is one of the targets.
Okay.
So it was pretty big and stuff like that. And I know that Tricia sent out information on that. I don't think that there was any positive response on that.
Well, now if we don't try, then we won't get it, but I think she's probably right. Susan's right. So our next meeting won't be until June, so June 11th. So stay tuned. We'll come back and tell you what happened then.
Anyone have questions or discussion for Sonia? Next committee is the Mental Health Advisory Board. Corey?
Nothing new to report because we don't meet again until May 20th. But again, in the minutes from last month's board meeting, you saw that, we have real interest in those 3 major areas: stable and safe housing, suicide prevention with a focus on youth and elderly, and reentry into the community for those coming out of the justice system. And so we really are just gathering information, and Amy Hancock, is now kind of putting together something like on a monthly basis to kind of move us along in those areas, just to gather information. And again, the Mental Health Advisory Board is not taking on a lead role in this at all. They simply are looking at how they can gather information and be advisory to other groups that are definitely working on that. And I know Susan would speak and may want to speak to this, that certainly that's things in the mental health action plan that are being looked at as well. So it's just really just trying to do whatever we can do with some of the expertise on the Mental Health Advisory Board to add to the solutions. And I don't know, Jessica, are you going to talk about the upcoming virtual town hall in Spanish, or should I throw that in here?
Why don't you go ahead, Corey? Oh, never mind.
Okay. So you'll remember that Judy Buchanan and I are on a whole nother group. It's kind of called the Health Equity Community Task Force. And Marianne Manco joins us when we meet. And there's other members like the NAACP, et cetera. And so and you remember that back in February, we hosted a vaccination facts virtual town hall. And so now we're doing one very similar to it, and that's going to be on April 20th from 6 to 7 p.m. And it will be in Spanish. We have two wonderful doctors, Dr. Galloway and Dr. Yambe, that are going to be answering questions, obviously, in Spanish. We also have someone from the health department is going to remind everybody about COVID protocol. We also are going to speak to issues like public charge, that people that have immigration that are kind of relevant to people in the dealing with immigration issues. So we're hoping that it will be very relevant for our Hispanic and Latinx brothers and sisters, citizens. So we're very happy to be moving that along, and we're scrambling right now because it's coming up next Tuesday. Or I should say, we also have the principal of Bent School who is going to be the moderator, and that is Gia Delgado. So again, great group of people to work with.
Go ahead,
Corey,
Susan.
is there a flyer or an announcement or an event thing that people can refer to post on Facebook or to share with other people that
Most definitely. Mary Ann and Amy Brooke have been working on getting a flyer, and we kind of decided because of the short turnaround, it's kind of a save the date and flyer all at the same time, and that should be going out en masse tomorrow to anybody and everybody we think that can put it on their websites and get the word out to the right people. So yes, that's going to be, I may have even gone out late this afternoon, I'm not sure, but it will definitely be out tomorrow.
Marianne is whispering in my ear. The flyer is finished and it'll go out soon. Yeah. Okay. Go ahead, Hannah.
Just a question that raised in my mind. I know in our packet we had some information on the number of vaccines given. How are we looking in terms of the distribution within our minority community? Are we still seeing a lag in those numbers? Are they? And I know these forums are designed to try to focus on those groups and encourage them to get vaccines. I didn't know if we had any sense of those numbers.
Sorry, we had a little bit of a lag. Let's check at IDPH's website earlier. We still are slightly below what our county census data shows for our African American population, and I believe Hispanic as well. But I think we're at 4% for the African American. I think the county is about 8%. So we definitely have some work to do still to reach our most vulnerable and make sure that we're ensuring vaccine equity. And that's something that we're going to continue to work on.
Tanya?
Now that it's opened up for the public over age 16 and so on, are we seeing immediate flood of people, everything immediately filled? Tomorrow will be the day for a new calendar of openings to come. So what's happened since this is opened? Did it open Monday?
So, I mean, we're still filling appointments. We're not having issues filling the spots, but clinics are posted on Thursdays around 11. And I think even last week, which was the first official week of being open to everyone 16 and over, it may have still been around 24 hours. The appointments were still available. So yes, we're still seeing interest, but they're definitely accessible.
I guess I'm still hearing people say, oh my goodness, I'm going to drive to Springfield, or I'm going to drive to, somebody said I'm driving up to Iowa to get mine because I can get it easier. It's a longer wait. And what would we say to that?
I would encourage them to look on our website for when appointments are available. And also on the website, they can sign up to receive updates from us. So usually Thursday morning, we send out an email to all those subscribers, letting them know when new appointments will be opened. And if they can't get on a computer, if they don't have computer access, or maybe have a little bit of trouble scheduling on a computer, they can call the call center. So I know the call center has scheduled a lot of people.
We've had some volunteers who've also done scheduling, the United Way team. And so I don't know how that's still going, whether that's as busy or not.
Yeah, not as busy. We had a couple targeted clinics where we had different community groups that helped us schedule the appointments. So we've kind of gotten away from that now, but we may have to use it again if we're doing other targeted clinics.
Yes, okay, thank you.
Any other questions? Susan? County Board, Health Committee?
Health Committee doesn't really have a whole lot to report. It was pretty mundane meeting. But I do want to kind of sort of address, Hannah's comment about that American Rescue Act and what I had mentioned earlier. There's still a lot of unknowns yet. I think that they're still evaluating what is required, what is, what are the parameters around there. I mean, it's not just here's a pile of money. Like with the CARES Act and the Cures, there were very specific parameters, where this is not as necessarily as strict parameters around what can be done with the money in the city. I mean, there's lots of money going for the city, this money going to the town, the counties, because I think that there was a lot of push for municipalities to recover some of the funding that they lost with COVID. And also in that is money for vaccinations, where I know that Jessica had mentioned that, going forward, there's not been a lot of money for vaccinations, and that could be a problem. And I think in that act, there was also money on that. So I don't know if that'll be a pass through the state or what. Definitely when there's discussion at the county board level as to this funding, I'll make sure that we have the health department, prominently displayed for money to address some of these issues that we know we have to provide one way or another. So that's why if we can use that money first before we go into our reserves and still have reserves for other things, that would be great. But I will advocate for that.
Hannah, go ahead.
So Susan, do you think it would be a wise idea at this point for the Jessica and staff to maybe look at where there was mention that maybe we don't have enough money for vaccinations, or now we're looking at contact tracers, to put together kind of a quote wish list or something that says, here's where we see we're going to need money. So, as whatever happens with kind of deciding how to spend that, there's something to refer to.
I think it would be a good idea to be prepared for any kind of, things like that when it all gets evaluated as to what's going to happen and how it's going to happen.
Are there any other comments or questions about the county board? All right, and Hannah, Behavioral Health Policy and Funding Committee?
Thanks, Carla. Yeah, we finally met after kind of a hiatus. We met March 26th, and we had a rather lively discussion. We had 3 items on our agenda. One was looking at the reports that are, for the funded programs, both the ones through 2020 and then the ones that we've now funded for 21. I know, Bob, you had a question about how agencies were making up shortfalls. And I think we did confirm that at least with Center for Human Services, they use their own reserves for that. But we talked quite a bit about the format of the report and how there's some confusion that it's not real clear. It spells out how much of the health department money spent, but it reports clients served across the total program. So there are other funds that support those programs. So we're kind of getting an apples and oranges look at our own funds. So we talked quite a bit, and we're trying not to keep reinventing the wheel. It seems like in this area every year we start from scratch again, I think, as Corey pointed out. So we're trying to at least take what we've got and see where we can tweak it. So Amy was going to work on maybe putting together a new format that might be a better guide of showing what the actual expenditures are. I mean, the report just showed the health department money as a lump sum, as both money in and money out. So we'll be bringing that to you as we look at the next set of quarterly reports. And certainly if anybody has any questions about data they'd like to see on those reports, or, better idea of how the money is being spent, either talk to me, Carla, or Amy, so that we can make sure we got a report that gives people the information they want. We then moved into just a general discussion again about the funding process and timeline. We didn't really look at the timeline too carefully, but with the process, we wanted to kind of acknowledge historically what we've been doing, and maybe figuring out a smoother way, or again, not starting at square one. For example, we have several programs that we consistently fund year to year and have done so for a very long time. So we asked our legal counsel to look into whether we could develop a way of basically making this a renewal application as opposed to an application for new funding every year. Let me see, there was something else. And we also discussed our school programs. We have the embedded schools, and thought that money might be better managed if we found a, sort of single source to award a grant to. And I think we were thinking the Regional Office of Education might be a recipient that then could distribute the dollars or make hires, so that it would be, maybe more efficient use of the funds, rather than we're starting kind of on the back side of that is what we thought. So we're going to explore that further, and certainly Corey or Susan, if you want to jump in at any time, feel free to. So that's where we are on that. And then, of course, we were going to review the Mental Health Advisory Board funding priorities, and that's an ongoing process. I think we'll try to take what they've presented and hone it down a bit and see where that fits into the funding that we provide, because it's obviously a lot of very big aspirational list, and so we want to see where it is that we can put our dollars that would fit within those priorities. So, and we'll meet again at the end of the month. So if anybody has anything they'd like to bring to our attention, please feel free to do so. And I assume we could add people to the committee too, Carla, if anybody wants to join.
Certainly, if anyone wants to join us, we have quite lively conversations and discussions, so you're welcome to join us. It's a standing committee, so we do Open Meetings Act, so there's more than 3 of us on the committee. So let Hannah or I know, and we'll get you set up, or Amy Hancock. Does anyone have any questions for?
None of us on the committee are opinionated at all. So, you would just tell.
Well, we keep trying to figure out how best. I mean, we have a very small piece of the puzzle now with about 1.5 million year to year. And so, we don't want to keep going back and saying we should have done it this way or that way. And so we're trying to be conscious of moving forward every year. So that's it. I don't know if anybody has any questions.
Go ahead, Bob.
Thanks, Hannah, for acknowledging my question from last time. And also thanks to that committee, because it's a very important committee. But really, I was just, I know that everything works out in the end, but we're just getting one piece of the puzzle in that report from last month. And I was just trying to connect the dots to have a complete story, almost like a footnote of, when it wasn't meeting the full budget, where did that money come from? It was more of just an accounting question than anything. Thank you.
Any other concerns? And I'm going to apologize to everyone and Amy for jumping out of order in the agenda. So we've talked a little bit about the administrator's report. I just want to be sure, were there any other questions or concerns that we need to address with that? Susan, go ahead.
Are we on Hannah's stuff still, or are we on the administrator's report?
We're on the administrator's report, but if you have a concern for Hannah, you could bring that up.
No, I have a question, and it's not really on her report. However, I do want to make a comment. I like the funny stories in the communicable disease section or the call center. But I have a question and for Jessica, and if Tom might have to join in on this. When someone talks about capacity on a restaurant, what is the definition of capacity or any gathering place, like a event center or whatever? What is the definition of capacity when it comes to COVID? And then how is that determined in like a large space, like a ballroom of some kind, or how is that determined in a restaurant, and capacity, and how it relates to whatever level of capacity we're at right now in whatever phase we're in, because I don't even remember what the capacity levels are.
And I will apologize. I missed the first half of that. We were muted here. But yeah, I see Tom is unmuted, so he probably does know better the capacity answer for you. That's the part I heard.
So there's no overriding rule. It's all based upon the type of facility that you're looking at. My staff and I have access to the Department of Commerce and Economic Opportunities guidelines, and they change every time the phase changes in Illinois. So right now, I believe we're at 50% capacity. I could be wrong with that. That's why we go back to those guidelines whenever we're asked the questions. The difficulty is that in the rural areas, no one establishes, well, let me back up here. The state of Illinois has given two different capacity or percentages of capacity just in restaurants and bars alone. There's a seated capacity and there's a standing capacity. But when municipal fire departments who establish occupancy loads using life safety code, they only give seated capacity or overall capacity. They don't give a standing capacity in at least the southern counties. You might find that up in Chicago and the surrounding counties, but they don't do it in McLean County. So we just have to estimate when business owners call us and inquire about that. The fire department sets those occupancy loads, but we're expected to give an answer on behalf of the fire department that sets those loads. And we use the DCEO guidelines for that. Indoor areas for public conveyance, such as ballrooms, again, that's a little bit different based upon the overall square footage. It is the lesser of, and this is just an example because it's been a 25%, 50%. We've never seen a 75%, but it's the lesser of an established static number or 50% capacity. Again, it all depends on which phase we're in. Outdoor venues, we're working with the organizer for the third Sunday market. That's even more complicated because you have a conveyance of people. You have to try to maintain their distance in an outside area. There is a given formula for outside areas for flea markets. But then they also have indoor spaces too, which would fall back to an open area. And it's difficult because we don't have an occupancy load for that type of venue when you have numerous vendors in there, tables, and patrons walking through. As an example, with we've given some options for the organizer, excuse me, of the third Sunday market to consider basically monitoring the number of people going in, number of people coming out, basing the overall area on a 36 square foot radius around each individual on the outdoor portions of it. So last time we talked with the organizer of the third Sunday market, he was going to go back, work with the numbers, and present something to us to see if we thought that it would work for him. So it's all going back to the guidelines of DCEO, depending on which state we are, which phase we're in. And it's the indoor occupancies are the lesser of the static number or the percentage capacity.
So when you said the fire department was, and their occupancy, it's this, you said seated?
It's generally seated capacity. It's based upon overall square footage, the number of patrons, the number of static tables, the number of movable tables, movable chairs. Life safety code is a very difficult code to work with. We don't work with it. The fire department, municipalities do. Building and safety departments work with life safety code.
So how would some, I'm sorry, Corey, I know you have questions. So how would someone plan something based on that? If they wanted to have a graduation party, or they wanted to have it in a restaurant, or if they wanted to have it versus in a like even a side room in a restaurant or that kind of thing, how do they determine how many people they can have in a situation like that? Because there are some restaurants in town that have like side rooms, and then you have rooms that some of the hotels that can handle like a ballroom kind of thing, where you could have more people possibly based on the square footage. And so I guess, how are they supposed to try to figure out what they want, how to plan something and still stay within the guidelines and not get reported to whomever for violations of something?
Those guidelines are available on the DCEO website. They are very difficult to navigate and find the information. So if a business owner contacts us or an organizer, we've had people call us that want to have weddings and want to know how many people they can invite to the wedding. We help them through it. It's difficult. The general public's try to contact DCEO directly. DCEO doesn't respond very readily to the general public. Myself and my staff have been very fortunate in that when we contact the DCEO on behalf of the general public, we tell them who we are, where we're working, and this is the question. And I have to give DCEO credit on this point. They'll get back to us in about 24 hours with an answer to our question. So we will help the public to the extent possible in navigating through those guidelines.
Sure, Corey?
Yeah, I just had a question about how are you, Tom, are you still getting, or is there been an increase, decrease in the in information you get about violations?
So compared to this time last year, significantly lower. It was very quiet until we saw this recent wave come through, and then we started seeing more complaints. But again, a fraction of what we saw this time last year. People are concerned, rightfully so, about the numbers going up, and they want to make sure that everyone's doing their part to keep those numbers low.
And then I had one other question, and that is, are you ever at odds with the fire department occupancy? I mean, is DCEO and the fire department occupancy issues ever at odds with each other? Or how do you, because it sounds like because of the different capacities that you look at, has that ever been a problem or no?
Whatever the occupancy rating is for that establishment, that's what we use.
Okay.
I don't know that the fire departments have had any issues with the DCO guidelines. I haven't heard back from any of the fire chiefs.
Okay, so as far as you know, it's all coordinated well.
As far as I know, yes.
Awesome, okay.
At the time we figure all this out, we'll be past this crisis of COVID. I'm hoping.
Sorry, Sonia, Jessica and I were switching between our speakers. Could you repeat that, please?
I was just going to say, by the time we get this all figured out, we'll be past some of this crisis with COVID. I'm hoping we'll figure out how to live with it. Thank you, Tom, for your work on this.
Thanks. Tom, if you could express our thanks to your staff. I know this has been this last year and a half has been incredibly trying for them. And it seems like they're doing a really good job. So I just be sure that they know the board appreciates their work.
I'll be very happy to express that to them during tomorrow's check-in.
Great, thank you. I might even come down one of these days and say it myself. Does anybody have any other questions or concerns about the administrator's report? Scott, go ahead.
I was just wondering, when someone gets vaccinated at like the arena, does the health department keep a track of a record of who is vaccinated when, or does that go to the state? Or I'm just thinking down the road, if this vaccination passport thing becomes more important, and people have lost their card, can they get a record of where they were like when they were vaccinated, instead like a proof, whatever?
Yes, so vaccines are entered into the iCare state registry. So just like the rest of their vaccine record, an iCare provider doesn't have to necessarily even be the health department, but an iCare provider could look that up and print them a record. So everybody gets a vaccine card, but people may lose that. So if they do, they can get a printed out vaccine record from iCare.
Bob, go ahead.
Would like to learn a little more, or mainly give a compliment to this flyer on the National Public Health Week, Building Bridges to Better Health. Compliments to who put this together, the visual of it, the information content, the friendliness of it, the colors and everything is excellent. This is the first time I saw this one. I was looking on the website. I didn't see it there. I know it was Health Week from last week, but to me, this is a document that we should keep up on the website and use, because it's just so informative and tells the whole breadth and depth of everything that the health department does. So I think it's absolutely excellent, and I'd like to have it used more as an ongoing promotion for all the services that the health department does.
Kim, do you want to take a bow? Jessica told me it's Kim Anderson that developed the flyer.
Thank you. It was developed as Facebook posts. So if you're on our Facebook page, you'll see them. Each section is posted by itself. And then I just put an aggregate together so that Jessica could present that tonight.
Hannah, did you have, yeah, go ahead, Hannah.
I had a couple questions that are not related to the reports, but just some follow-up questions. I didn't know if it would be better to ask them now or after our action items.
Go ahead and ask them now.
Okay. One had to do with way back when, before BC being before COVID now, I guess. We had people who help people navigate the health insurance exchanges. And since they've kind of reopened that and added some benefits under the American Rescue Plan, I didn't know if we still had people who had those skills and whatever in terms of helping people get signed up for health insurance, or whether we knew where to send them, since obviously I think it's really critical now that people get insurance as much as they can. So just a question on that. My second question is, there was just announcement that there was an approval to expand Medicaid coverage for women postpartum to a year, and I didn't know how that would impact us, if at all. So, and those are not, bring them back next month, or if somebody knows, they can say now. But
Yeah, Jessica does not know. So anything really before COVID was before Jessica. So I will have to check into number one, and then number two, I will have to check into that one too to see. You know, I haven't even read about the Medicaid expansion yet, but see how that might impact our services or benefit our services.
yeah, I wondered if maybe our family case management program might be able to provide additional help postpartum for women, and so.
Oh, Corey? You are muted, Corey. Still muted, Corey.
I linked there for a minute. Okay, so I just had a question about, do we have open positions that you're still having a hard time filling? Is that creating, and where is that creating the most problem for you? And yeah, how, is there anything we can do as a board to help with that?
I mean, yes, we have nursing positions that are open and vacant, which right now definitely creates a challenge for us when it limits the number of vaccinators that we have on staff. So, I mean, we can have further conversations about, you know, why that is. And but yeah, I think further analysis of what is causing the extended vacancies, because they're open for a lengthy period of time. And then recruitment, we don't get as many applications for the positions either. Susan?
Yeah, I think, didn't we talk about this at Health Committee a little bit with, I know I talked about this recently. Maybe, was it Health Committee, Jessica, when someone asked about that question on staffing?
I don't
It was either
remember.
that or the nursing home, but I
It
think
was
that we're actually,
Yeah, the nursing home has, I know, in just a couple of months ago, I think, talked about it.
Right, and I do know that administration's going to be looking at some of these pay scales again. I mean, we've looked at them numerous times over the last couple of years, and Hannah, even when you were there, we've looked at them several times, I think, too, and made adjustments. So we are aware of some of these issues and working towards trying to address them. And like I said, it's not just the health department, it's also the nursing home still too. So, but I also have a question. Is that if that's okay, Carla? Okay. I really like this vaccine breakdown chart that you provided in the packet on how many doses we've received and what kind of doses and that kind of thing. So I have two questions about that. Number one, I know that we got all that Johnson & Johnson last week now, and there was 5,300, and I don't think we gave 5,300 of those, did we? Or not? And then has IDPH said anything about making up those doses that we are not using of the Johnson & Johnson to try to address the issue, because they wanted them to go to the students at ISU and Wesleyan? And are they going to make up that in some other way to us? And then what's doses kept and first doses administered? What's the kept part? So those are my two questions on that. But I thought that this was a really nice graphic that was very helpful.
Yeah, so for the Johnson & Johnson, until really this week, we hadn't received much Johnson & Johnson, and we had just one clinic left of the university clinics to hold, and we've been working with IDPH to ensure that we have vaccine. It'll be just a different type of vaccine to still hold that same clinic. And Johnson & Johnson's it's a pause right now, so they're still going to stay in inventory for now. But again, we didn't have any other Johnson & Johnson clinics scheduled coming up, so we'll be okay in that sense. Then kept versus administered. So the top charts that you have, the total doses received by county, that's for McLean County as a whole from IDPH. So there's about 7 or 8 other providers that we've, over the course of this, have been providing vaccine to as well, that have been helping out. And so the bottom part is doses that McLean County Health Department has kept and administered. So this is not all of the providers, that's just us. So just showing the doses that we have kept and administered.
So going back to the Johnson & Johnson, how is that going to then affect some of we talked at the health committee about outreach to Homebound and things like that. Are we going to just move forward with that, with just a 2-dose type thing then at this point with what you've been working on?
Yeah, so, we were looking for the Johnson & Johnson to be for rural clinics and other clinics that were, it's difficult to have a second dose or get someone back to the site and the clinic. But we're going to move forward with what we've still need to do. So it's on pause right now, but we've got a mission still to get people vaccinated. So we'll keep moving forward and use the vaccine that we have for what we need to do.
Did they decide anything today? I know they met today about the Johnson & Johnson thing. When do they anticipate having some sort of a more definitive decision about who they might be able to use it with, since they know it pretty much is more of a concern for women at a certain age range? So it seems to me that perhaps, but now everybody's going to be nervous about it. So do you know if there's any date when they're going to give some more definitive answer about who it can be used with safely?
I think ASAP didn't get back with anything by the time I left the house, because I was watching, unfortunately, I'm watching the news, so I could, that's the only way I have of getting information. I think what we'll probably find out and I'm basing this on what's going on in Canada with AstraZeneca, is that you may still be able to use the vaccine, but it'll only be for, like for men or for men and women over the age of 50, depending on what they see in that data. I think that's what the delay is that the ACIP wanted to really look at Johnson & Johnson's data to see, there's 6 cases out of 7 million, and I'm not trying to minimize that, but what were the characteristics of the women other than ages? Were there other things such as, the big thing that came up in my mind was contraception, because that's a really frequent problem with blood clots in general. It's something that we know about. So I think we'll just wait until ACIP gives us some guidance, and then we'll know where to go from there. Sonia, go ahead.
Jessica, when you said, so we'll just go ahead and use what we have, do you mean use others, not Johnson & Johnson?
Yes, so the Moderna and Pfizer vaccine.
Yeah, you just use those and rest with the Johnson & Johnson, put it aside until we get a clear message we can use it. Is there a timeline on storage on that? If you keep it cold, is it okay?
Yeah, so there's definitely storage, handling, and a timeline. But again, luckily, we hadn't received much vaccine, Johnson & Johnson vaccine until just last couple of weeks. So, it's shelf life. But we'll get information from IDPH on what to do with the vaccine if and when we would have to do something else with it.
Yes. It's unfortunate because that will change your plans on getting to students and getting out in the rural areas. 2 trips is a challenge.
All right, Corey.
I just wanted to say again to all of you, Jessica and your team, that are just every single day confronted with some crazy new thing that you have to figure out and deal with and communicate about. And I just want to thank you so much for hanging in there, for staying so committed to the mission and putting the health department and the safety and public needs way ahead of your own personal lives right now. We truly do appreciate the huge sacrifices you're making. You're giving so much time and talent to just that, and it never ends. And we do so appreciate what your willingness to hang in there.
Yeah, we definitely have amazing staff here that have been just going nonstop for over a year now, and I don't think enough can be said about just all of the time and energy and dedication that they've all put in just over the last year of, yes, constant changes and adaptations. And I've said it before, in media, that if there's one thing that we have done very, very, very well, it's just adapt and be ready to change, because we can't keep doing the same things when we get new information. So that's something that this health department and staff should be very proud of, is just their ability and willingness to kind of go with the flow and change. But because there have been a lot of changes with COVID.
Well, and you have been so steady at the helm, and we so appreciate that, because your steadiness and calmness has, I'm sure, really helped the staff be able to maintain the positivity and the just commitment as well. So we appreciate that.
And I just have one thing to add to that for both Jessica and Tammy and her staff. I had the pleasure of doing 2 vaccine clinics at ISU and sat with the nurses from the health department. And it was a very pleasant experience, if you can imagine, during a vaccine. It was good. It was good for me to get out and listen to folks, but the staff that are very, very professional. And I constantly hear from the community, comments, positive comments about how smooth the process is at Grossinger, how well they're treated. I'm not hearing the complaints about because we've got the people in the, United Way helping with getting people on appointments. And then we also have the call center that's helping. So I think things are really starting to smooth out, and that is a testament to everybody's hard work. So again, from all of us, thank you so much for everything that you do. Any other comments? All right, let's move on to our action item, maybe. So we have an action item for the approval of the fiscal year 21 COVID-19 mass vaccination contract that was in your packet on pages 23 to 64. Susan, go ahead.
I'll make motion to approve.
Susan moves, Sonia second is a second. Sorry, Amy.
That's okay.
Any discussion? Questions? All right, Amy, if you could please call the roll.
Carla Cole,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Sonia Reese,
Yes.
Susan Schaefer.
Yes.
Motion carries. Is there anything else for the good of the order? Everyone is quiet, so everyone have a great week. Hopefully we'll get back to having summer again. And if anyone, I'm going to have this is a self-promotional plug, was for the health department. On NBC at about 8:30 in the morning, there's a very nicely done public service announcement that Mary Ann put together, and it's starring myself and Rodney, thank you. My mind could completely blank. Rodney Davis. So if you want to see cows and people hugging and me and Representative Davis or Senator Davis, join us. Susan, go ahead.
I have a question about going back to in-person, because I got to believe probably every one of us has been vaccinated. And so I'm kind of curious, as I know the county board, I think, has extended it only through May right now. And so I guess I kind of like to hear what other people have to say about that, because I really do think that in-person meetings are better than this, even though we can see each other and stuff like that. I think that there's a lot to be said for being in person. And so I kind of wanted to know what everyone's thoughts are on that one.
It's Dr. Janetti. I do like in-person meetings much better, but we are surging. The vaccines are not 100%. We've had people vaccinated get COVID. I'd like to see the numbers go down. Before we meet back up to try to do what we can to keep this under control. That'd be my gut feeling, and not, do what we can to, curb this. But I do want to get back as soon as possible, because I think it's nice to see the room and read the room.
Jessica, did you want to say something? Okay, hang on. Okay, go ahead.
And just in the sense of social distancing, we are currently at half of the meeting room right now. So that would probably it might cause a difficulty. Just we're using the other half of the room. So there's two rooms here that have a divider in the middle, and half of it's being used for contact tracing. So it limits our space a little bit.
I would prefer to wait just a little bit longer. And again, I'm not sure 2 months from now we'll know anything different, but I guess I just would like to, like Dr. Janetti was saying, maybe just watch the numbers a little bit more before we go back in person. But yes, we certainly should be aiming for that.
Sonia?
I would say I agree on holding off now that we're seeing a little surge here. I don't know where that's going to go, but we got to get that under control. And when that happens, then we'll all feel better about being out anywhere.
I didn't intend to mean it for like next month or anything like that. I was like looking, further down the road as to
Yes.
what kind of plan that we might have.
And I'm agreed, somewhere down the road, just not right away.
Hannah?
And I see, I don't know, Chris, if you're with us, we've got your name, whatever. I mean, they modified the Open Meetings Act to allow us to do this, and I don't know if there's a sunset provision in that, or where that may stand, but clearly, I mean, that could force us back in person, but I don't know if there was something written into the law when they amended it with a time frame. But I agree with everybody else. I think let's take it slow and make sure we're all good before we move back to in person.
Jessica's got the lights. Oops. You're gonna tuck there. Okay, now.
By the way, and I just wanted to point out, to my knowledge, I don't think there's anything in the OMA amendment that was, and I don't know if you said sunset clause, but I don't believe there was when it first was amended at this point in time. So we're still good to use those going forward.
I think we'll just have to wait and see what happens, monitor the way things are. Obviously, next month I'm relatively certain that next month is going to be virtual like we are now. I know that there are several community members that are pleased with being able to follow the health department, the Board of Health meetings online. So we'll wait and see what happens mostly with the numbers and be cautious, just like we're telling the public to be cautious and not have family gatherings. Try to keep your social distance. Don't hang out with folks who aren't in your household, that type of thing, so that we can try and keep the spread down and keep our numbers down, because our hospital utilization is dangerously high. Anything else? Well, with that, everyone have a great week, and the meeting is adjourned.